Welcome to Pixarize's scene for TSC, or Tuberous Sclerosis Complex, a disease that is so challenging for me to say, it sounds like my mouth is full of tubers. My own aphasias notwithstanding, I should be able to guide you through this TSC construction site without any injuries. Now let's get to work. As you can see, our construction workers are just getting started, and they haven't accomplished much. Their top priority will be to move these massive tubes, and we're going to make them our first order of business as well. That's because these cement tubes will help us remember tuberous sclerosis and help us remember the characteristic clinical finding for which the disease got that tricky name. Tuberous sclerosis refers to the sclerotic benign cortical tubers in patients' brains. The complex portion of the name comes from the finding of benign tumors elsewhere in the body. We'll be sure to hit up all of those as we make our way through the rest of the scene. But first, let's start with the genetics of TSC. See this big, menacing excavator set up near the tubes? If you've been watching our videos, you'll recognize that this large, dominant vehicle is our recurring symbol for autosomal dominant disorders, and indeed, TSC follows an autosomal dominant inheritance pattern. However, not all cases of TSC are alike. Take a look inside the excavator, where we've added a pair of fuzzy dice, our recurring symbol for variable expressivity. Despite inheriting mutations in the same TSC genes, patients may experience all of the clinical findings we'll cover or none of them at all, a phenomenon known as variable expressivity. Just like rolling a pair of dice, you never know what you're going to get with TSC. In fact, patients may not even know which gene is mutated unless they get a genetic test, and that's because there are two different gene mutations that can cause the disease. In most cases, the mutated gene is TSC2 on chromosome 16, which encodes the protein tuberin. We've represented chromosome 16 by adding a driver's license on the seat here, since you need to be 16 years old in order to get one. I really hope the owner of that license brought his whole excavator to the DMV in order to pass the test. Parallel parking that seems difficult. The other possible mutation occurs in the TSC1 gene. TSC1 encodes for the protein hamartin and lies on chromosome 9. If we zoom back to our concrete tubes, we can see that they've been there for so long that they're growing vines. Vines to remember chromosome 9. That's mighty fine. I should probably get out more. So TSC1 and TSC2 encode for different gene products, but they cause the same disease. How's that? Well, their gene products are both important tumor suppressors. That's why the mutations cause all of these growths. We've represented this with our recurring symbol for tumor suppression, a gun with a suppressor. This time, our suppressor is stowed in the glove compartment of our big scary excavator, just to make it that much more terrifying. Now that we've gotten past the complicated genetics of tuberous sclerosis complex and the complicated pronunciation of tuberous sclerosis complex, let's move on to the complicated complications of tuberous sclerosis complex. Let's start with hamartomas. It makes sense that hamartomas could be caused by a mutated hamartin protein, and if we scope out the rest of this construction site, we're bound to find some hammers to help us remember that. Ah, there they are. A toolbox full of hammers. I hear their build quality is unparalleled. These hamartomas grow in the CNS and skin of TSC patients and are made up of local tissue elements. Because of their variable composition, we've put several different types of hammers in the box. Nice, huh? Next, take a look at the corner of the construction site. We see that the workers have set up a large spool of red construction fiber. This coil of red fiber probably serves some important purpose on this site, but it's most important for conjuring an image of the angiofibromas in the skin of TSC patients. These fibrous bumps are composed of coiled blood vessels and connective tissue. And speaking of spools, who's this leaning against an empty one? Ah, it's the driver of our excavator and the owner of that licensed, legally purchased, tumor-suppressing firearm. Let's check out that tough guy tattoo on those bulging biceps. And by bulging, I really mean bulging. That heart tattoo is really lumpy and misshapen. I'm not going to say that to his face, but I will tell you, since that lumpy heart tattoo is an important symbol representing cardiac rhabdomyomas, or benign tumors of heart muscle that occur in tuberous sclerosis complex. And cardiac rhabdomyomas aren't the only heart problem TSC patients have to deal with. See our Macho Man's miter hard hat? Its shape might not be effective for deflecting falling debris, but it's very effective for symbolizing the mitral valve prolapse seen in TSC. Man, mitral valve prolapse is the first non-OMA we've covered. Hamartoma, angiofibroma, cardiac rhabdomyoma. These would be really hard to keep straight if it wasn't for Pixarize. Now, let's discuss renal angiomyolipoma. No, I'm not kidding, but it's the last OMA before we go HOMA, so let's knock it out. If we look beneath our misshapen cardiorhabdomyoma tattoo, we can see that he's holding some coils of red wires near his flank. Maybe he's the electrician on the site. In any case, these red wire coils should help you remember the prefix angio, and they're located at the flank to help us remember that renal angiomyolipomas are seen in TSC. These are benign tumors of the kidney that are composed of vascular tissue, angio, smooth muscle tissue, myo, and fat tissue, lipo. When you break it down, it's really not so bad. Okay, let's cut back to the spool he's leaning on and find out why he's leaning there instead of getting his wiring done. It looks like he's been smoking cigars on the job again. See the ashes coming from those burning leaves? These are meant to symbolize ash leaf spots, a sign of TSC often presenting in infants that can help make an early diagnosis. Ash leaf spots, or hypomelanic macules, are hypopigmented areas of skin caused by a lack of melanin. Finally, take a look at our tough guy's arm. Maybe he got burned on the job as an electrician? I don't know. That green patch he's put on isn't quite big enough to cover the wound. Oh well, the least we can do is use that green patch on his skin to help remember another skin finding. Shagreen patches. Areas of thick, leathery skin often seen in TSC patients. Okay, let's leave that guy be and check out what his coworker is doing. There are a couple of weird things going on with him. First off, he's using a jackhammer to break into grass. What? And second off, he's dressed like he belongs in the Wild West. This eccentric Western dude is there to remind us that infants with TSC often develop West syndrome, an epileptic disorder comprising infantile spasms, altered EEG, and mental retardation. His jackhammer-induced vibrations help us remember that seizures are a common clinical finding in TSC. Last, but definitely not least, we see that Mr. Turtle has arrived on the scene. Turtles are a recurring symbol for developmental delay, because what's more delayed than a turtle? Well, other than this construction project. Alright, before we sum things up, I have a confession. There are still a couple more OMAs. Luckily, these are pretty quick and relatively low yield, so I'm just going to mention them. TSC is also associated with an increased incidence of subependymal giant cell astrocytomas and ungual fibromas. There, that's it. I'm out of OMAs, I promise. Let's recap. Tuberous sclerosis complex is a neurocutaneous disease with a litany of clinical findings that may or may not be present in patients because of variable expressivity. Remember our fuzzy dice. These include hamartomas, represented by our box of hammers, angiofibromas, represented by our pool of red fiber, cardiac rhabdomyomas, represented by our guy's misshapen tattoo, renal angiomyolipoma, represented by the coil of fibrous red wire near our guy's flank, and, like I just mentioned, an increased incidence of subependymal giant cell astrocytomas and ungual fibromas. It's caused by mutations in the tumor suppressor genes TSC2 or TSC1 on chromosomes 16 or 9, respectively, and it can present with ash leaf spots, shagreen patches, seizures, and developmental delay. Man, that was a lot. But we're done, and y'all have earned a break. On test day, just think of the big tubes at our construction site, and you'll remember all you need to know about TSC and be that much closer to earning that full-length white coat. You might not want to think about that diploma, though. Until next time.